Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exams. In today's session, we are going to break down the knee joint into clear, high-yielding, exam-oriented concepts. So let's get started. So knee joint is the largest and most complicated joint in the body. It is the major weight-bearing joint and so it is more prone for osteoarthritis. So that is why the anatomy of knee joint is very important. So when we come to the type of joint, the knee joint is modified. When we say the type, we say it is a modified hinge joint of synovial, modified hinge variety of synovial joint. Okay, modified hinge synovial joint. So why we say modified hinge is because, see, when we say hinge joint, the movement is only in one direction, so flexion and extension. So here, along with flexion and extension, there is conjunct rotation movement. Okay, lateral rotation as well as medial rotation happens slightly, and so that is why we say it is a modified hinge joint. It is also a compound joint. Okay, it is a compound joint because it consists of three articulations. So if you see the lateral as well as here, this is the lateral here, lateral as well as the medial femorotibial articulation happens. So this is condylar type because both the condyles of the femur and the tibia, they articulate. So this is condylar type here, and there is the intermediate here. If you see, there is femoropatellar articulation, femoropatellar articulation here, which is of saddle type, saddle variety. So that is why we also called it as a compound joint. So because there are more than two bones articulating there. So let's move on to the articular surfaces here. So articular surfaces, when we see in this is the femur. So in the femur, the articular surfaces, okay, of the medial and the lateral condyles. Okay, so the medial and the lateral condyles of the femur, they form the articular surfaces. Medial and lateral condyles, they form the articular surfaces, as well as the trochlear surface. This is the trochlear surface. So where the patella articulates. Then we have the articular surfaces of medial. So this will be the medial and lateral condyles of tibia. Medial and lateral condyles of tibia. Okay, so this is tibia. Along with this, we have the patella. So in the patella, the posterior surface, okay, the posterior surface of the patella articulates with the trochlear surface of the femur. So here we divide this posterior surface of the patella into larger lateral part and a smaller medial part. And there is a small medialmost strip. So this will be articulating with this portion here, okay, of the medial condyle here if you see. So this part it will be articulating. And this here, the different surfaces, okay, the different surfaces of this posterior part come in relation to the femur in different movements. Okay, so here if we see the upper part, okay, so this upper part here will be in flexion when we try to flex. Then we have the middle portion here, this is in slight flexion. And this portion comes in contact during extension. And this small strip which I said will come in full flexion. So this is about the articular surfaces of the knee joint. Next, moving on to the ligaments. So, stability of the joint is mainly provided by the ligaments. So, any joint, it is mainly the ligaments which provide the support. So, here we have very important ligaments, that is the capsular ligament, then we have the ligamentum patellae, then we have the tibial and fibular collateral ligament, anterior and posterior cruciate ligament, okay, and the menisci, medial and lateral meniscus are there. Along with this, there is this secondary ligaments, okay, secondary ligaments which you can remember with the mnemonic COAT, C-O-A-T, COAT, okay. So, what is this COAT? C is for the coronary ligaments, coronary ligament, O is for oblique popliteal, and A is for arcuate popliteal, and T is for transverse. Okay, so these basically they are the accessory ligaments or the secondary ligaments. So we will first go to the main ligaments. We will study the main ligaments of the knee joint. Okay, so the important ligaments of the knee joint, as I said, first is the capsular ligament. So here first we will study the capsular ligament. So capsular ligament here, it is a thin fibrous sac. Okay, so if you see, it's a very thin fibrous sac which we see, and it surrounds the joint. So this capsular ligament, it is mainly deficient anteriorly. Okay, so anteriorly it is deficient. So where it is replaced by the patella, the quadriceps femoris, the ligamentum patellae, the medial and lateral patellar retinacular. So all these structures, okay, so the patella, the ligamentum patellae, the quadriceps femoris and the medial and lateral patellar retinaculae, they replace this deficiency here, okay, where the capsule is deficient. So when we see the femoral attachment, okay, so the femoral attachment, it is attached about half to 1 centimeter, okay, 1 centimeter above the articular margins. So here if you see anteriorly it is deficient, okay, in this portion, okay, anteriorly in the middle part here it will be deficient, and it is pierced here by the suprapatellar bursa. Okay, so supra, there is a gap here for the suprapatellar bursa. So bursa is there. Okay, so in this portion. Then posteriorly here it is attached to the intercondylar line here. Okay, intercondylar line, and laterally it will enclose. Okay, so laterally it will be enclosing in this part it will be enclosing the origin of popliteus. So this is important. It encloses the origin of popliteus laterally. So that is in the upper part. In the tibial attachment, it is attached about half to 1 centimeter beyond the articular margin. So here anteriorly, if you see, anteriorly it will descend like this. Okay, so it descends along the margin of the condyles to the tibial tuberosity. So here it is deficient here because of the attachment of the ligamentum patellae. Ligamentum patellae is attached here. Okay, so because of which it is deficient here. So posteriorly here there is a small gap, okay, and that gap is behind the lateral condyle. There is a small gap for the passage of the tendon of, so the tendon of popliteus will pass through this gap. So this is about the capsule. Okay, so the capsule basically deficient anteriorly, that is of the femur, okay, anterior surface of femur. So there it is deficient, where it is replaced by the patella, the quadriceps femoris muscle, the tendon of quadriceps femoris there, as well as the ligamentum patellae and the medial and lateral retinacula of the patella. And it also encloses the origin of popliteus laterally, you should know that. And below in the tibia, it is deficient near the tibial tuberosity, where we have the attachment of the ligamentum patellae. okay, and there posteriorly it will show a small gap laterally there where we have for the passage of the tendon of popliteus. So that is about the capsular ligament, and this capsular ligament is lined by the synovial membrane. Okay, here one thing you have to remember is this is the intercondylar area where the synovial membrane will not be there. So it only, other than that, it will be lining the capsule. Next we have the other ligaments. So coming to the other ligaments, here we can see this is the tibial collateral ligament. We see the meniscus, medial meniscus as well as the lateral meniscus. Medial meniscus, this side is lateral meniscus, and here we have the fibulocollateral ligament. Then we have the cruciate X-shaped. Okay, so here we have the cruciate ligaments, anterior and posterior cruciate ligaments. So these ligaments, they are very important ligaments, okay, which provide support to the joint. The meniscus, they divide this joint cavity into upper and lower compartments. Upper, that is meniscofemoral, and below that will be the meniscotibial compartments. It divides the menisci. So we will see about it. So here you can see the cruciate ligaments more. Cruciate, these are the cruciate ligaments. This is the ligamentum patella. These are all the bursa which are located beneath. Okay, so these are the important ligaments. So we'll go by one. One is the collateral ligaments. Now this is the tibial collateral ligament. Tibial collateral ligament. So the tibial collateral ligament, if you see, it is strong. Of the two collateral ligaments, it is strong. It is long at about 10 centimeters. Okay, it's long about 10 centimeters in length. So as well as it is very thick. Okay, so this is mainly because it is more thicker and stronger than the lateral collateral ligament, because the knee joint gaps more medially. Okay, on the medial side, the gapping, it gapes the two condylar surfaces. No, when they articulate, there is a little gaping there, because of which we need stronger support medially. So that is why this ligament is long, strong, thicker. Okay. So here if you see, it has two bands. Okay, above it will be attached to the medial epicondyle of the femur. So here it is attached to the medial epicondyle of the femur. And if you see, there are two bands. This is the superficial band and this is the deep band. Okay, superficial and deep band. So the superficial band, it is very long. It is attached below to the upper part of the medial border of the tibia, as well as to the posterior part of the medial surface of tibia. Okay, so it will be attached there. And the deeper part of the ligament here, if you see, it is short and it blends with the fibrous capsule. So this will be blending with the capsule. So between that, you can see here this superficial, it will be covering the inferior medial genicular vessels and nerves. So these are the inferior medial genicular vessels and nerves. So it will be enclosing these structures. Means basically covering these structures. On the outer part, you can see these tendons of these gyrope muscles. Okay, these are the gyropes muscles, that is sartorius gracilis and semitendinosus. Okay, so they are known as the gyro muscles. So that will be the relation there of the tibial collateral ligament. Whereas the fibular collateral ligament, otherwise called as the lateral collateral ligament, and also about this tibial collateral ligament, it is basically morphologically the tibial collateral or the medial collateral ligament. It represents the ischial, okay, insertion of the ischial head of the adductor magnus muscle. This is the lateral fibular collateral or lateral collateral. Okay, so fibular collateral, or it is also called as the lateral collateral ligament. So it is short, just about 5 centimeters long, and if you see, it is cord-like. Okay. It is cord-like, it's not like thick like the medial collateral. And above it will be attached to the lateral epicondyle of the femur, and below it is here, if you see, it is attached to the head of the fibula. So that is its attachment. And this fibular collateral ligament, basically it represents the, like morphologically, it represents the degenerated tendon of peroneus longus. So the fibular collateral ligament or the lateral collateral ligament, it represents the degenerated tendon of peroneus longus. Okay, so this is peroneus longus degenerated tendon. It represents this. So here it will be between the capsule, this is the capsule, and that there will be we have the inferior lateral. So that side we saw inferior medial. So here we see on the lateral side inferior lateral genicular vessels and nerves. So that is about the fibular collateral ligament. Next, moving on to the cruciate ligaments. Okay, so the cruciate ligaments, they are two thick bands. They are, since they are in the shape, the way they are attached, it looks like X, so that is why we call them as the cruciate. So there is an anterior cruciate, okay, so we have the anterior cruciate and posterior cruciate ligament. So basically they are very important to maintain the antero-posterior stability of the knee joint. Okay, so here one thing you have to remember about cruciate ligament is cruciate ligaments are intracapsular whereas extrasynovial, because we see them near the intercondylar area, okay, the attachment there, where it is outside the synovial sheath but inside the capsule. So it is the cruciate ligaments, we tell they are intracapsular but extrasynovial. Okay, that point you should remember. Sometimes they give in the MCQs, all but one is true, they'll give some statements and you have to choose the right one or exclude the wrong one. So in those cases, these things are commonly asked. So anterior cruciate ligament, if you see, it is attached below to the anterior part of the intercondylar area of the tibia. Okay, so the anterior part of the intercondylar area, and from there it runs upwards and backwards and laterally. Okay, so both of them, they have some kind of opposite thing. So if you see, this is attached where to the anterior part. Okay, so attached to the anterior part, and from there it runs upwards, backwards and laterally. Okay, upwards, backwards and laterally, and is attached where? Attached to the posterior part. Okay, attachment then is to the posterior part of the medial surface of lateral condyle of femur. Posterior part of the medial surface. Okay, posterior part of medial surface. Posterior part of medial surface of lateral condyle. Of tibia. Whereas the posterior cruciate ligament, when we see, okay, the posterior cruciate ligament, it is attached to the, so here I said anterior part, here it is the posterior part of intercondylar area of tibia. Okay, so here, then the opposite here. Okay, so it runs upwards, yes, but upwards instead of backwards, it goes forwards and medially. Okay, upwards, forwards and medially, and is attached to, now this is the opposite, anterior part of lateral surface. Okay, anterior part of lateral surface of the lateral surface of medial condyle of tibia. Okay, so if you remember one, the other one is the opposite of that. So that is about its attachment. Okay, so why these are important is whenever the knee joint is in extension, okay, it is very tight, very taut, okay, during extension, because it maintains that antero-posterior balance, right? So when it is in extension, it is very taut. So what happens, this anterior cruciate ligament, you should remember, it prevents, okay, it prevents the posterior dislocation. So anterior cruciate prevents the posterior dislocation, okay, posterior dislocation of femur on the tibia and anterior dislocation of tibia, on femur. Okay, so that is the anterior cruciate ligament, whereas the posterior cruciate ligament, what it will do, it will just do the opposite. So what it does, it do, it prevents the anterior dislocation of femur and posterior dislocation of tibia. Okay, just the opposite, right? So this is the important thing which you should remember about the cruciate ligaments. So next is the medial and lateral meniscus. They are also called as the semilunar cartilages because they are crescent shaped or semilunar shaped. If you see, the medial one is more semilunar, whereas the lateral one is circular. So this is the medial, this is the lateral. So these are made up of fibrocartilage, and if you see, the periphery of it is very thick and the inner border is thinner. So these menisci, they deepen the articular surfaces and they divide this joint cavity into upper compartment and the lower compartment. Upper compartment we call it as the meniscofemoral and lower compartment we call it as the meniscotibial compartment. Flexion and extension usually takes place in the upper compartment, whereas the rotation of the knee occurs in the lower compartment. So if you see each of these menisci, it has two ends. Okay, so it has an anterior end and a posterior end. So this is the ends. So anterior end of both, and here we have the posterior end. And it has two borders, the thick outer border and the thin inner border, and two surfaces. The upper surface is concave because it is in the middle. It is dividing the compartment upper and lower, right? So the upper surface here will be concave. Okay, upper surface of it looks concave for the femur, whereas the lower surface is flat. Okay, it's basically flat for the peripheral 2/3 of the tibial condyles. So first coming to the medial meniscus now, a little more in detail about the medial meniscus. So here if you see, it is semilunar in shape and wider behind than the front. So it has two horns, two ends, okay, the anterior and posterior ends, or it's also called as the horns. So now these, they are attached in the, this is the intercondylar area. Okay, so this is the intercondylar area. So here it is attached to this intercondylar area. And the medial meniscus, other thing is also adherent to the deep part. Okay, deep part, the tibial collateral ligament had two parts, right? The superficial and the deep part. So this one is attached to the deep part of the tibial collateral ligament. And here at the sides, if you see, here it will be attached to the tibial plateau by this coronary ligament. Okay, so the coronary ligament, I told you, it is one of the secondary ligaments. So here it is attached by that, okay, to the tibial plateau by this coronary ligament. Now compared to this medial menisci, the lateral one. Okay, so the lateral one is circular. If you see here, it is more circular in shape. So it also has an anterior and posterior horns which are attached to the intercondylar area here. So the posterior horn, okay, so the posterior horn of this lateral meniscus, it is attached to the, you have to remember, the posterior horn of the lateral meniscus is attached, okay. So the posterior horn of lateral is attached to the medial condyle of femur. Medial condyle of femur by two ligaments, okay, by two ligaments which we call them as the anterior and posterior menisco, because it is attached meniscus to the femur, right? So meniscofemoral ligaments, okay, meniscofemoral ligaments. So the anterior meniscofemoral ligament, it is called as the ligament of Humphrey. Ligament of Humphrey. And the posterior one is known as the ligament of Wisberg. So these ligaments, they play a very important role in regulating the movements of this lateral meniscus, okay, especially during the extension of the knee joint. So these two, medial and the lateral menisci, they are very important, one because they increase the concavity, okay, concavity of the tibial condyles, so as to for a better congruence with the femoral condyles. They also act as swabs, okay, they act as swabs to lubricate the joint cavity. They act as shock absorbers, okay, they act as shock absorbers too, and they adapt to the varying curvatures during the curvatures of basically the femoral condyles. So that is basically the important functions of the menisci. So here a word about its injuries here. So the medial meniscus is more prone to injury, okay, so meniscal tears are very common. Basically it is caused by the twisting strains of the knee joint, especially in the flexed, slightly flexed knee joint, okay, especially like, you know, while kicking, like in football, playing the football, like kicking in the football. So these meniscus, they may get separated, okay, they may get separated from the capsule, or it may be torn longitudinally. When it tears longitudinally, we call it as the bucket handle tear. Bucket handle tear it is called, okay. So it is basically the longitudinal tear of the meniscus. So it can be torn both longitudinally or transversely. Longitudinally we call it as bucket handle tear. So now this among this, the medial meniscus is more prone for injury than the lateral meniscus. One, because it is firmly fixed to the tibial, the deep part of the tibial collateral ligament. Okay, so any greater exertion during, okay, or greater pressure during the rotatory movements can cause its tear. Whereas lateral meniscus, what happens here is it is protected by the popliteus muscle. Okay, so the popliteus muscle, the medial fibers will pull the posterior horn. It will pull the posterior horn of the menisci backwards so that it is not crushed between the articular surfaces. So that is how the lateral meniscus is protected from injury compared to the medial. So pain on the medial rotation, okay, medial rotation of the tibia on femur, when the pain is more, it is basically because of the medial meniscus injury, whereas if the pain is more on lateral rotation, it is lateral meniscus injury. So that is about those. Then coming to the bursae around the knee joint, okay. So bursae in relation, so there are about 12 bursae in relation to the knee joint. 12 bursa in relation to knee joint. So there are about 4 anterior, 3 lateral, 3 medial and 2 posterior. Okay, 4 anterior, 3 lateral, 3 medial and 2 posterior. So the anterior bursa, if you see here, okay, so we have the subcutaneous prepatellar bursa, subcutaneous. So this is the prepatellar bursa, subcutaneous because it is beneath the skin. It is the subcutaneous prepatellar bursa. This is the subcutaneous prepatellar bursa. So it is also called as the bursa of the housemaid's knee. So this is deep to the skin in front of the lower half of the patella, if you see here. Okay, and in ligamentum patella, in relation to these two, you will see lower part of the patella and upper part of ligamentum patella. Then we have similarly the subcutaneous infrapatellar bursa here, that is in between the skin and the tibial tuberosity. Okay, so there we will see. Then there is deep infrapatellar bursa. This is the deep infrapatellar. So it is between the ligamentum patella and the tibial tuberosity here. Okay, so the deep infrapatellar bursa. Then we have the suprapatellar. This is the suprapatellar bursa. So suprapatellar bursa is basically between the anterior surface of the lower part of the femur here. This is the femur. So between the femur as well as the deep surface of the quadriceps femoris tendon here, which we can see. So these are the bursa, 4 bursa which we see anteriorly. In the lateral side here, if you see, it is between the fibulocollateral ligament. Okay, here between the fibular collateral ligament and the tendon of biceps. So this is one. Okay, between the fibulocollateral ligament and tendon of biceps. Then we have between the fibulocollateral ligament and the tendon of popliteus. Okay, here. And one more, we have the bursa between the tendon of popliteus here. Bursa between the tendon of popliteus here, as this green thing is the tendon of popliteus. So here bursa between the tendon of popliteus and the lateral condyle of femur. Okay, so this bursa is basically an extension of that synovial membrane itself. So it communicates with the joint cavity, this bursa, which is between the tendon of the popliteus as well as the condyle of the femur. Okay, so these 3 bursa we see laterally. Then medially here, okay, so on the medial side we see the bursa which separates the tendons of these 3, okay, these 3 gyrope muscles. So this is one, the bursa which separates the gyrope from the tibial collateral ligament. This bursa we call it as the bursa anserina. Bursa anserina. Okay, so bursa anserina. So this is between the gyrope muscles as well as the tibial collateral ligament. Then there is a bursa here, if you see, between the semimembranous tendon, okay, semimembranous tendon as well as the medial condyle of tibia. So this is the second bursa which we see, and this also communicates with the knee joint. And next is the bursa between the tendon of semimembranous and medial collateral ligaments. So third here will be this one. Okay, so these are the 3. Okay, between the tendon of semimembranosus and the tibial collateral, between the semimembranosus as well as the medial condyle of the tibia, and between the gyrope and the tibial collateral ligament. So those are which we see it on the medial side. Posteriorly we will see 2 bursa. Okay, so the bursa in the posterior side is between the lateral head. Okay, posteriorly we will see one is between the lateral head of the gastrocnemius and the capsule of the joint, lateral head of gastrocnemius and the capsule and capsule of the joint. Another one will be the medial head of gastrocnemius and medial head of gastrocnemius and capsule. Okay, so this is also called as Brodie's bursa. Okay, so this bursa has a name, Brodie's bursa. So these are the bursa which we see in relation to the knee joint. So knee joint, the blood supply of the knee joint, it has a very rich blood supply with the anastomosis between the branches of popliteal artery, which gives all these genicular arteries, popliteal artery, tibial artery, as well as the circumflex branch of posterior tibial artery also will give the branches which will anastomose around the knee joint and they supply the joint. Whereas the nerve supply, it receives supply from the femoral nerve, okay, through its branches basically to the vastus medialis muscle. Then we have the tibial and common peroneal nerves which supply through the genicular branches, and there is obturator nerve which supplies the joint through its posterior division. So that is about the blood and nerve supply. So coming to the movements, we mainly have the flexion and extension. That is the main movement of the main or active movement. Okay, so flexion. So flexion is mainly brought about. Okay, so the main muscles, if you know, it's good enough. So the semimembranosus, basically the hamstring, semimembranosus, semitendinosus and biceps femoris. Okay, so they bring about the flexion. The extension is by the quadriceps femoris. It brings about the extension of the knee joint. So the rotation, okay, so the medial rotation is by the semitendinosus, semimembranosus and the popliteus, whereas lateral rotation is mainly by the biceps femoris. Okay, so these are the muscles and movements brought about by these muscles, okay, of the knee joint. Next, there is something very important which you need to know is the locking and unlocking of the knee joint. So what do we mean by locking and unlocking of the knee joint? Okay, so when the foot is on the ground, the locking is defined as the medial rotation of the femur on the tibia. So the foot should be on the ground and there should be medial rotation so that the foot is just fixed there. Okay, the knee joint is fixed and stability is maintained in the standing position. So for that, what happens? The femur rotates on the tibial condyle medially, and that is known as locking of the knee joint. So this movement is basically brought about, the locking is brought about by the locking is nothing but medial rotation brought about by quadriceps femoris. So this happens in extension. Okay, so it is the terminal phase. So complete extension. So terminal phase of extension. So in this locking, all the ligaments become very taut. They are all very tight. Okay. So that is, so locked knee is very rigid, absolutely rigid. Whereas unlocking, again when the foot is on the ground, the unlocking is defined as the lateral rotation of the femur on the tibia. So this is lateral rotation of femur on the tibias. Okay. So this happens during the initial phase of flexion. and it is brought about by popliteus. So here the ligaments are relaxed. So that was about the locking and unlocking of knee joint. Okay, so locking, basically the medial rotation of femur on the tibia during the terminal phase of extension, which is brought about by the quadriceps femoris, whereas the unlocking is mainly the lateral rotation of the femur on the tibia, which is brought about during the initial phase of flexion, and the muscle which brings about that is the popliteus. So in locking, the ligaments and all are tight because it's in complete extension there, whereas here it is flexing, so that is why the ligaments are relaxed. So next, so this is what we can see during the locking and the unlocking. So this is popliteus muscle which brings about unlocking. It's a commonly asked question. The popliteus muscle which brings about the unlocking of knee joint. So while we are walking, okay, during locomotion, this locking and unlocking keeps taking place alternatively and rhythmically. So coming to the clinical anatomy, so the injury to the cruciate ligament, okay, so this is basically the injury to cruciate ligament. So the anterior cruciate ligament, okay, so the anterior cruciate ligament is more commonly injured compared to more than the posterior cruciate ligament. So this happens, anterior cruciate ligament injury happens in case of anterior dislocation, okay, anterior dislocation of the tibia, whereas the posterior ligament is injured in the posterior dislocation of the tibia, okay. Anterior cruciate ligament happens in case of anterior dislocation of tibia and posterior cruciate ligament tear in posterior dislocation of the tibia, right. So because these cruciate ligaments, they maintain the anteroposterior stability, okay. So when these ligaments are torn, what will happen? The abnormal stability will be there, or mobility, anteroposterior mobility becomes abnormal. So here we have something known as the drawer sign, which you need to know. Drawer's sign, okay. So there is an anterior drawer sign and posterior drawer sign. So we'll see what is anterior drawer sign and posterior drawer sign. So if the anterior, okay, if the anterior cruciate ligament is torn, okay, so what happens? Tibia is pulled excessively forwards, right. There is anterior with anterior cruciate ligament tear, there is anterior dislocation of the tibia. So it is called anterior, like a drawer, the anterior is anterior, the tibia gets dislocated anteriorly, whereas in posterior drawer sign, that is when there is a posterior ligament tear, cruciate ligament tear. So what happens there? The tibia is pushed backwards, okay. So there is the excessively backwards. So that is known as the posterior drawer sign, okay. So in anterior dislocation of tibia, we get the anterior drawer sign positive, anterior drawer sign, basically because of anterior cruciate ligament tear, okay, anterior cruciate ligament tear, whereas in the posterior drawer sign is basically when there is posterior cruciate ligament tear, okay, posterior cruciate ligament tear. So this happens when there is the posterior dislocation, when there is posterior dislocation of tibia. Osteoarthritis is very common because it is the weight bearing joint. Osteoarthritis, okay, is common of the knee joint. So knee pain is very common. Then we have the bursitis, okay. So prepatellar bursitis, or also called as the housemaid's knee, okay. So this is housemaid's knee. So earlier when they used to kneel, and mop the floor, there used to be continuous friction of the bursa against the patella. So that led to, because of the continuous contact of the bursa on the ground. Okay. So such a bursa, usually this housemates, so it becomes very big and it just drops. Okay, so this is the prepatellar bursitis. Next we have the clergyman's. This is infrapatellar bursitis. Okay, so it is the inflammation of the subcutaneous infrapatellar bursa. So this is basically because of friction of the bursa against the, so bursa will be, there is friction against the tibial tuberosity. So this happens in case of kneeling down, and especially those who lay down the tiles, those tile workers and all of them, right? So in them we see this infrapatellar bursitis. Then we have the Baker's cyst. So Baker's cyst, otherwise known as the popliteal cyst. So popliteal cyst is basically the chronic inflammation. It's a chronic inflammation of bursa which is deep to, so here the tendon of the semimembranosus, okay, deep to tendon of semimembranosus. So this presents as a cystic swelling, okay, so fluid filled cystic swelling will be there of the synovial membrane, and which we will see in the popliteal fossa, in the medial part of the popliteal fossa. So that is Baker's cyst or popliteal cyst. So we can see it here on the posterior aspect. So osteoarthritis, I already told you. So there is narrowing of the joint space. So this is the joint space. So here we can see the formation of this known as osteophytes. Okay. So the movements will be very painful, limited, and they produce something called as grating movement, we say. So when we take a radiograph and see, we can see these osteophytes. They are basically peripheral lipping of the articular ends. Okay, so these are the things which we see. Then there is arthrocentesis. Arthrocentesis, whenever there is collection of fluid. Okay, so collection of fluid is quite common in knee joint. So it gives rise to swelling above and on the sides of the patella. So in such cases, what we do is we do a patella tap. Okay, patella tap, that is known as the arthrocentesis. Patella tap. So aspiration of this fluid, okay, it is done in one triangular space. Okay, we say it as, you can see it here. So that triangle here, it is formed by the apex of the patella. So from this triangular space, so usually it is on the lateral, either side of the ligamentum patella. Okay, so there we do. So it is between these bony points. One is the apex of the patella. Then we have the lateral condyle of femur and the tibial tuberosity. So these three bony points are used as landmark, and from there we do the arthrocentesis. Then we have arthroscopy. Arthroscopy is basically an endoscopic examination or visualization of the knee joint. Okay, so where there is minimal disruption during this procedure, any minimal disruption of the tissues is there. So sometimes even the ligamentum repair or replacement is also performed during this procedure. Then, so this is how it is viewed. The knee replacement. Okay, so if the knee joint is badly damaged, when there is a badly damaged knee joint, especially by osteoarthritis, okay, so it happens because of the continuous friction there, the joint space and reduced and there is friction between the two articular surfaces. So the joint will be damaged. So in these cases, what happens? We do a replacement by an artificial joint. So here it basically consists of the tibial components will be plastic, okay, whereas the femoral components will be metal. So the damaged area is removed and then it is replaced. Then there is something known as the unhappy triad, which you should know. What is unhappy triad of knee joint? Unhappy triad of knee joint. It's a commonly asked MCQ question. So combination of three injuries, okay, three main injuries where it involves the tibial collateral ligament, the medial meniscus, and what do you think is the next? It is the anterior cruciate ligament. Okay, so all the three ligaments which are prone for injury also, all the three are involved, and of course the knee will be very unhappy. So that is why we call it as the unhappy triad of knee joint. Okay, so it involves the injury of tibial collateral, medial meniscus and anterior cruciate ligament. So let's begin with the image based MCQs. So first one, draw test positive, that is anterior movement of tibia indicates injury to. Okay, so when there is excessive anterior movement of tibia, it's mainly the anterior cruciate ligament tear. Okay, not the posterior cruciate or medial or lateral collateral ligaments are not involved. Posterior cruciate, posterior movement will be positive, posterior draw test will be positive. Next is sagittal section of knee joint showing two crossing ligaments. Okay, two crossing ligaments. The highlighted structure runs from anterior intercondylar to posterior part. So what will be that be? Posterior, that is the anterior cruciate ligament. So the highlighted ligament primarily prevents which of the following? It prevents the posterior dislocation of femur and anterior dislocation of tibia. So this is the answer, which is the right choice, B. Next, superior view of the tibial plateau showing medial and lateral menisci. A longitudinal tear is seen in the medial meniscus. Which feature makes the medial meniscus more prone to injury? It is circular in shape. No, it is semilunar in shape. It is not attached to tibia. It is attached to the plateau, right, by the coronary ligament. It is firmly attached to medial collateral ligament. Yes, this is the right. So it is firmly attached to medial collateral ligament. So that is more, because of that feature, it is more prone for injury. Inflammation of the bursa shown is commonly called. Okay, so here it is about suprapatellar bursitis. So it is house meets knee. Which muscle is responsible for unlocking of the knee joint? Unlocking of the knee joint is mainly by the popliteus. Locking is by the quadriceps femoris. So that's a wrap for today's session on knee joint. So be consistent with the series, as consistency is the key to success. I'll see you in the next session.